Welcome back to the channel. If you are second year BDS student panicking about general pathology, take a deep breath and you are in the right place. Okay, so today we are covering one of the most high yield guaranteed topics in your syllabus, that is edema. And mark my words that this is a guaranteed 10-mark long answer question in your university theory exam. So it also pops up constantly in viva and short notes like Transudate versus Exudate or pitting versus non-pitting edema. Yes sir. So by the end of this video you won't just understand edema, you will be able to write an answer that makes the examiner gives you full marks. Okay, so grab your notebook and let's jump straight into it. So first thing first, definition. Okay, and definition is edema is the abnormal accumulation of excess fluid in the interstitial tissue spaces on or in serous cavities. Okay, now why does fluid normally stay inside our blood vessels without leaking everywhere? So let's look at the normal fluid exchange at the capillary level using Starling Forces. Okay, so first is arterial end, and then capillary end, and then venule end. So arteriolar end, the pushing pressure called hydrostatic pressure, that is 35 mmHg, it pushes fluid out into the tissue. Then comes plasma oncotic pressure, that is 25 mmHg, and the pooling pressure from plasma proteins, mostly albumin, stays at 25 mmHg, and the net result at arteriolar end is 35 minus 25, that is hydrostatic pressure, and plasma oncotic pressure minus is equal to 10 mmHg. So this much pressure is putting on the arterial end and 10 mmHg pressure pushing fluid out. Okay, and then second is venular end. In venule end, hydrostatic pressure drops to 15 mmHg, but oncotic pressure remains at the 25 mmHg. Okay, but and the net result is at venular end is 25 minus 15, that is 10 mmHg, pulling fluid back in. So 10 mmHg at arteriolar end pushes fluid out, and net absorption at venular end 10 mmHg pulling fluid back in. So lymphatic removes excess fluid and maintain balance, and if any of these factors would be disturbed, then it will cause edema. So that is called edema. Okay, so whatever tiny bit of fluid is left behind in the tissue gets picked up by our drainage stream, that is lymphatics. And the gold rule is, which you have to remember, that edema happens whatever this balance get disturbed. Okay, now comes to the causes and mechanism, that is etiopathogenesis. So now let's move to pathogenesis and causes. There are 5 main mechanisms and you must list in your 10-mark answer. Okay, what is the 5 main mechanism? That is increased hydrostatic pressure, decreased plasma oncotic pressure, increased capillary permeability, lymphatic obstruction, sodium and water retention, and others, that is hypothyroidism, myxedema, and pregnancy physiologic edema. Okay, so first increased hydrostatic pressure, that is more push. Okay, when pushing pressure goes up, fluid is forced out into the tissues, which causes congestive cardiac failure, venous obstruction, DVT, tumor pregnancy, portal hypertension, and constriction of arteriole, that is increased capillary pressure. Marked, it's important. Okay guys, now second is decreased plasma oncotic pressure, that is less pull. So if you don't have enough albumin in the blood, fluid won't be pulled back in. So if the fluid won't be pulled back in, it causes what? Hypoproteinemia, nephrotic syndrome, liver cirrhosis, malnutrition, protein losing enteropathy, and burns. Now third comes is increased capillary permeability. When endothelium gets damaged, gaps open up and fluid plus proteins lack out. Increased capillary permeability means leaky vessels. Okay, so this causes acute inflammation, allergic reactions, burns, sepsis and toxins, vascular endothelial injury. Now fourth comes is lymphatic obstruction, which is blocked drainage. If the drainage pipes are blocked, protein rich fluid collects in the tissue, so it causes malignancy, tumors, filariasis, post surgical or radiation scarring, and congenital defects. Fifth comes is sodium and water retention. More salt in the body means more water held in the blood vessels, that is higher the volume, which causes already edema. Okay, and इनका causes क्या है? Renal disease, hyperaldosteronism, Cushing syndromes, and excessive intake of salt and water. For your hack, for your memory hook, think of capillaries as leaking hose pipe. So the leak happens if you increase water pressure and make the pipe porous, that is permeability, and stop pulling water, that is oncotic, and block the drain, that is lymphatic. Okay, so try to memorize it like a leaking hose pipe. Now we come to the types of edema. So according to distribution, localized edema confined to one area, example swelling in an inflamed finger, or pedal edema in DVT. Okay, and generalized edema, that is Anasarca, a widespread edema involving large part of the body, causes hypoalbuminemia. So in generalized edema, widespread severe edema involving the whole body, subcutaneous tissues and cavities. And remember this term Anasarca because examiner love asking it in viva. Okay, so this is the most important word, generalized edema. This is also most important topic. Okay, subtopic. According to the site. Okay, then types of edema according to site location. Then first come the subcutaneous edema under the skin, example pedal edema, and subcutaneous edema occurs in loose areolar tissue beneath skin, that is pitting type. Second is serosal effusions, accumulations fluid inside bodily cavities, hydrothorax, pleural cavity lungs, ascites peritoneal cavity abdomen, and pericardial fusion around the heart. So these are the 3 points which is important. Okay, now according to nature of fluid, Transudate and Exudate both are the most important topic, and it comes in the short answers question, which comes in 5 marks or 2 marks. Okay, So Transudate non-inflammatory, low protein, low specific gravity, clearly watery fluid due to imbalance in hydrostatic or oncotic pressure. Okay. An exudate is high protein, high specific gravity, turbid, may contain cell due to increased capillary permeability. Example, inflammation, infections, TB. And this is a note कि most edema in subcutaneous tissue is transudate because capillary permeability is usually normal. Okay, then come to according to the duration, acute edema, chronic edema, and according to pitting edema and non-pitting edema. These are both important subtopics. So acute edema develop rapidly and subsides quickly. Example, acute inflammation, allergic reactions. Chronic edema develops slowly and persists for long, leads to tissue changes. Example, chronic venous obstruction and lymphedema. According to pitting edema present leaves a pit indentation. Okay, immediate impression on pressure, and वही नॉन पिटिंग में नो इम्प्रेशन ऑन प्रेशर. लोकेशन ऑफ पिटिंग एडिमा सबक्यूटेनस टिश्यू, and the location of non-pitting edema is deep dermis and dense tissue, lymphedema and mixed edema. Okay, mechanism of the pitting edema, these are the diagrams. Normal tissue, no edema. If finger presses, no pitting is there, so it's normal tissue. But if finger presses, pressure applied, pitting is there, pit forms on pressure, that is this, and pit जो है वो थोड़े देर तक दिखेगा आपको वहाँ पे if आप प्रेशर लगाओगे. तो दिस इज एग्जांपल ऑफ द एडिमा, एंड आप चेक भी कर सकते हो. ओके, सो कंपैरिजन pitting versus non-pitting. So impression on pressure, pitting में present, non-pitting में absent. Location subcutaneous tissue, deep dermis, dense tissue. Causes में transudate means increase hydrostatic pressure and decrease oncotic pressure. Non-pitting में lymphatic obstruction, mixed edema, fibrosis. Reversibility में reversible. Pitting edema, non-pitting edema often irreversible. Examples of pitting edema, pedal edema, facial edema, ascites. And non-pitting में lymphedema and mixed edema. Now to wrap up our 10-mark answer structure, let's look at why edema matters clinically. Okay, so mild edema may be asymptomatic or causes mild discomfort. Severe edema causes discomfort, impairment of function, and may complicate underlying disease. Edema in vital organ, lung, brain may be life-threatening, and persistent edema leads to fibrous tissue proliferation and organ dysfunction. So, in pulmonary edema, lungs में, patient can literally suffocate in their own fluid. That is why it is life-threatening. And in brain cerebral edema can cause herniation and death because the skull जो है वो expand नहीं होगा, because उसमें इतनी fluid भर गई है कि skull उतना अच्छे से काम नहीं करेगा, and skull cannot expand, so it causes herniation and death. And persistent chronic edema leads to permanent tissue fibrosis and permanent swelling. So, and that is edema made completely simple. This is the key points. Okay, excess fluid in tissues, causes, types, transudate, these are the key points. And summary is that ki edema is abnormal accumulation of fluid in interstitial tissue spaces or serous cavity. It results from imbalance in Starling forces, increased capillary permeability, lymphatic obstruction, or sodium and water retention. It may be localized, generalized, transudative, exudative, pitting or non-pitting. And identification of underlying cause is essential for the treatment. So if you get this question in your university exam, remember the structure. First you will write definition, then Starling Forces diagram, then its 5 causes, then classification, then comparison table, that is Transudate versus Exudate, pitting versus non-pitting, and then comes to clinical significance. So this are the मतलब ऐसे जो लिस्ट है उसके साथ में आप आंसर लिखना. सो फॉलो दिस सीक्वेंस, ये सीक्वेंस फॉलो करना. डेफिनेशन, स्टार्लिंग फोर्स डायग्राम, 5 कॉजेस, क्लासिफिकेशन, कंपैरिजन टेबल्स एंड क्लिनिकल सिग्निफिकेंस. सो यू आर गारंटीड इसमें इस क्वेश्चन में आपको फुल मार्क्स मिल जाएंगे. एंड इफ़ यू फाउंड दिस लेक्चर हेल्पफुल, hit that like button, subscribe to the channel and drop a comment below letting me know which general pathology topic you want me to cover next. Okay, and ये जो notes है, मेरा इंस्टाग्राम हैंडल है डेंट माइंडसेट, मैंने उसमें वहाँ रील डाली है, उसमें आप कमेंट करेंगे तो आपको नोट्स मिल जाएंगे, या आप मुझे डीएम करो कि मुझे एडिमा के नोट्स चाहिए तो मैं आपको भेज दूँगी. सो वहाँ मिल जाएंगे. And keep studying smart, and I will see you in the next lecture. Bye and take care.